Got it.
Well, hallelujah, hallelujah. Good evening, good evening. Y'all come on in, come on in. We want to welcome you to another broadcast of Raw and Upfront. And we're excited that you guys are able to join us here tonight. Of course, this guy you're looking at here is Jimmy Holley, and I'm excited to be the co-host. But as I said, I am the co-host.
We lost you, Pastor. Can you guys hear me?
Yes.
Yes. I don't know what happened to Pastor Holley, but he was in the middle of introducing himself. This has never happened. He was in the middle of introducing himself and me, but he was going to take you. There he is. Can you hear me, Pastor? You're muted.
He's muted, yeah.
He's muted, and I'm not sure what's going on, if he can even hear us. There he is.
Okay. Yeah. I clicked on the wrong thing there. But anyway, Minister Parker's here with us, and we have some exciting guests tonight, guys. I want to encourage you to come in and share the broadcast. Minister Parker, why don't you tell these people about these exceptional ladies we have tonight?
Yes, definitely. We're blessed to
I'll let her have some clears and water and stuff like that.
Two beautiful
no food.
Healthcare professionals with us tonight. To my left, top left is I know her as Lorraine. I'm sorry. she has a Facebook name. She has a professional name. Let's just say RN Pierre. Would that be okay?
That'll work.
Okay. And to my bottom right, we have Dr. Gamilla Pierre. And Dr. Gamilla Pierre is out of Chicago. And we were blessed to have her. It was touch and go because she had 3 patients in labor, and I think she just delivered 2, and I think there's 1 in the wings. But we're fortunate to have her here. For how long, we don't know. And Lorraine is in Los Angeles. She was deployed. She lives in New York, but she's deployed to Los Angeles, if I'm not mistaken, as a COVID nurse. And she has made her rounds with COVID. Not only being a recipient of it, but one of the people who care for those who contracted COVID. So thank you, ladies, so much for joining us. Our objective here is to get information to the public about COVID, how to protect themselves, how it's affected you and your profession. So let's get started with some of the questions. Pastor, you want to get started?
Yes. And once again, I want to encourage those that are watching to please share this broadcast, especially if you're in the Houston area. We are at the highest state of alert that you can be on for COVID. So yes, we want you to share this broadcast and give others an opportunity to be a partaker of this information. I'm gonna just start out with I guess the elephant that's in the country. There's a lot of people who are pretty much saying that COVID is nothing but a Democratic hoax and it's not real. Now, each of you have some experience, on-hand experience with dealing with people with COVID. Do you would you classify it as some type of hoax?
No.
Absolutely not. I get it though. I get, and I try to be as compassionate and understanding with people as possible when they express their concerns about, like, such as it being not real or a hoax. And I do get it. The CDC coupled with the media has in many ways, intentionally or not intentionally done a lot, not a horrible job as far as getting the messages out to people and delivering the message to the general public. And just generating fear and causing a lot of distrust due to inconsistent information. People have had a lot of misinformation to try to sift through.
You have more compassion than I have, because when I look at the number of people who have died from COVID, when people tell me that it's a Democratic hoax, I mean, I go berserk because I look at the number of people that have died, the number of people who have been hospitalized, family members that have been lost, a lot of my classmates and close friends, people I know on a personal level that have passed behind this virus. So like I said, I don't have the compassion in that regard.
So it is, we've made it worse on ourselves. So speaking back to what Lorraine is saying, the numbers for COVID are very high, but there have been cases where, and this is why people think it's a hoax, because someone comes in the hospital, they die of something else, they happen to have COVID, and so they are labeled a COVID death. And then the media says, well, or somebody says, well, that's not really a COVID death. So in all fairness, you can understand why people have a mistrust of what's out there. So what would have been great for the media and for the country would have been to just say, these are the facts. But unfortunately, we live in a polarized society. And so, and the administration we had at the time was also very polarized. So it was very difficult to just say, these are the facts, this is what's going on. And so when the media then would get partial information, it allowed things to be skewed. So you can kind of see where some people got jaded about the conversation around COVID. What I'll say is one day I decided, okay, maybe I never thought COVID was a hoax because I've worked in a hospital for the last 25 years. And in 25 years, I have never watched an entire hospital be shut down by any disease. So what you can say to COVID as a medical professional, what I'll say is this. Let's say COVID was a hoax. Then what I need somebody to explain to me is what all those people were admitted for. They were admitted for something. And if COVID was not a real condition, that was a very serious condition, then the number of people admitted in a hospital every November is pretty much the same. Those numbers don't really change. But when you all of a sudden see a hospital overrun by a disease every month, you can't then think it's not a real disease. So even if you don't want to think it's a hoax, all you have to do is walk down the hall and you can say, well, all those people who are testing positive for COVID, a lot of them are home and they're well and they're fine. That's true, granted. But a lot of people are sick in the hospital. And if you go back to 2018, that many people were not sick in the hospital in the ICU during the same months. So that's how you can, if you have trouble wrapping your brain around it, you can just look at the actual policy numbers about how many people died from total deaths in the United States and say 2017. I'm just making a comparison to 2020. So you can kind of then say, well, I might not quite understand all the nuances associated with COVID, but it can't really be a hoax if the number of deaths of people in the country is higher than it was in another time frame, in another year in the same time frame. I hope that makes some sense.
Lots of
Yeah,
signs.
I agree with you. I agree with you. Matter of fact, Minister Parker and I was talking about this the other day,
Yeah.
and I was saying that, you know, the thing is, if it's a hoax, they show convinced a lot of people to play sick and die
Right.
to pull it off, you know. And but yeah, I agree with you. I think that that it's important that people get the truth. But we're living in a society now where the latest conspiracy theory is is the norm, that everybody just look almost like people are looking for a conspiracy theory bandwagon to jump on.
Mm-hmm.
And so, but yeah, so we want you to understand, those of you that may be watching, and as the ladies say, who both work in the medical field, they understand your feelings, they understand uh, your uh, your belief system, but it is COVID is not a hoax. It's not a hoax. So if it's not a hoax, wouldn't you think it would be wise for us to follow at least the CDC guidelines with wearing masks and this social distancing and the virus and taking the virus? I mean the vaccine. Either one of you can jump on that one.
But it does amaze me that many of the people who kick science to the side, the moment they're sick, it's science they rely on to get better.
Mm-hmm.
It's just so ironic to me.
That I find that extremely ironic as well. And our hospitals right now at this point are being overwhelmed with patients who are unvaccinated and experiencing symptoms, you know, more moderate like symptoms, and they're coming to the hospitals. And I ask them, just curiosity, if you don't mind, why didn't you get your vaccine? Oh, I didn't trust the media, but they come to the hospital and trust that the hospital
Right.
is going to medicate them. And, I just find that, it's just mind blowing. Like, you didn't
You
trust
can't have it. You can't have it both ways.
that
Amen.
the hospital is based on. It's the same science.
Well, I have an interesting story. I have somebody that I know who works in the hospital, and they declined vaccination, and she and I had multiple discussions about it. She declined, but at one point she was going to lose her job, and her husband is against the vaccine. She's against the vaccine. They were never going to do it, and it came down to job loss with healthcare workers. And ultimately, she decided, I have to feed my family, so I'll get the vaccine. Well, ironically, shortly thereafter, both she and her husband contracted COVID. And she did fine. And they have 3 kids who are, middle school, kind of elementary school. She did fine. Her husband was quite ill, like on the brink, kind of ill. They're young. They're under 40. They're young people. And to this day, I mean, husband was very ill, not in the ICU, but probably one step from the ICU, went home on oxygen. And this is a guy who's about 40 years old, no medical problems. And to this day, they still don't believe in COVID. So I said, well, I was never going to ask her the question, like, how do you explain the fact that you did not get ill? You didn't get very sick from COVID, and therefore you could take care of your 3 kids and your husband was deathly ill, like literally on his last leg, and he didn't get the vaccine. What do you think about that? What do you think? They said it was just coincidence that they had that way, and more than likely, even if she had not gotten the vaccine, she still would not have gotten sick because she just wasn't the person to get sick. I said, do you really believe that? And she said, yes, I really believe that. I said, okay, well, Okay, we'll never know the answer to that. But some people, even to the point of somebody almost dying, some people get the vaccine, they end up unvaccinated, they're very sick, and they say, oh, I wished I'd gotten vaccinated. Mm-hmm. But you still have some people who remain unvaccinated and will still tell you this is a BS thing as they're sitting there with their last few breaths. Mm-hmm. So sometimes people's fear and their political beliefs are so indoctrinated and so ingrained that even the chance of getting sick and dying is not enough to convince them that, well, maybe this isn't a hoax after all. So it's kind of interesting. You see both sides of the coin there.
Yes. So, Minister Parker, you have a question?
Well, I want to make a statement, first of all, that it's so unfortunate that this tragic disease or virus has been so politicized.
Yes.
In the political arena. And that's unfortunate. But anyway, my question is, there's still those who don't want to follow the CDC guidelines, such as wearing a mask, social distancing, and even getting vaccinated. What do you have to say about that?
Well, so part of the problem, and I'm a physician. I believe in the CDC, but the CDC has created a lot of mistrust because of their, I won't say bad information, and it's not misinformation, but poor dissemination of information.
Yeah.
And so what happened is when we first started to figure out what does this whole pandemic and COVID mean, what people fail to recognize and fail to accept is that science is evolving. Science isn't the same today as it is 5 years from now. We evolved. Amen. We didn't used to know that smoking was bad. And then at one point we knew smoking was bad. So we evolve. And the CDC is used to publishing information. Yes, it's for the general public, but they're used to publishing information that people with some health care and health knowledge tend to read. Well, when this pandemic started, the way their information was disseminated, it made it difficult for people who don't have years of training of understanding what they're trying to say to understand what they mean. I'll give you an example about masks. So now people say, well, I don't trust the CDC. Well, it's not that they lied. They said in the beginning, wear a cloth mask. Now people are saying now the CDC is saying a cloth mask is no good. You need an N95. It's not that the CDC is going back on what they said, but clearly in the beginning of the pandemic, we didn't have enough supply. So what they said was a cloth mask is better than no mask.
Better than no mask.
Right. And so now we're at a point where we have sufficient PPE. So now let's talk about, we have sufficient PPE. Let's go to the quality of the mask. And so now we're going to talk about, okay, we have a mask. Now we use a good mask. But unfortunately, they have, partially because it's politicized, but partially because of how they disseminate their information, they haven't been able to explain to the lay public so that they understand this is the evolution of where we are in the pandemic. So it's not a change. They're not going back on what they said. Giving you the second example, the 5-day change in quarantine. Why did they do that? Well, people say, oh, well, they're lying. And even us medical professionals are a little bit inquisitive about that. Now, what is the real reason that they pull back on the quarantine? Because there's a shortage in healthcare. I guarantee you, I have nurses out every day. And so this is where it makes it hard for people to trust what they're saying. And then you kind of have to read between the lines. So the reason they pulled back on that is because by having a 10-day quarantine with Omicron, everybody getting sick, you literally did not have people to go to work in a hospital. You didn't have people. You didn't have doctors. You didn't have nurses. You were shut down. So they said, okay, if we look at the science, what is the least amount of time that somebody can quarantine? And they pulled back on it. Now, is that the best thing? No. But do we have to weigh people being able to get health care and having a lower likelihood, not zero likelihood of getting infected because they came out of quarantine a little early versus I don't have a nurse to run your ICU bed. So then you start weighing these things and you figure out what the weight is. Sorry, I'm going to have to get that call. So unfortunately, I feel bad for the CDC because they were kind of pushed into a position of talking to people who understood a lot about healthcare and then kind of gray area wishy-washy. Now they have to talk to the general public who don't trust them. And then they're not giving the information in a manner that's easy to trust. Now, with all that being said, yes, I think you should wear a mask. Yes, I think you should wear N95. And they haven't changed that. They've just evolved to say, what does our supply meet? And now our supply is better, so people can go to a higher quality mask. And there's very good evidence that when you are wearing a high quality mask and two people are, you are less likely to pass COVID back and forth. So that's a long-winded answer, but it's kind of important to think about so you don't just write the CDC off and say, well, they're quacks. Why are they saying that? But then you also understand that they have been trying to peddle and figure this out too, but they're having a difficult time in how to express this verbiage of something very complicated to lay people who are not used to interpreting what they're trying to say. And that's been difficult for them. I have to catch the call, so give me 1 second, but I'm still listening to you guys.
Okay.
Okay.
Lorraine, we were talking offline a few minutes ago, and you mentioned that that we were in. It goes back to the social distancing aspect of this whole thing. Like when you were in New York, wearing a mask is something you probably have to do 24/7 because of the close proximity of individuals in New York, as opposed to being in Texas, where you got, it's more spacious and you don't have houses upon houses, So what do you say to that about the social? I guess you call that some degree of social distancing.
Yeah, I mean, in New York City, social distancing, I found it was virtually impossible, even outside. The sidewalks are only but so big and you have so many people. So 6-foot social distancing is not going to happen. You're always going to have somebody in your face. So it makes sense to wear a mask, more so than to not. And I think that in New York City, most New Yorkers and most of the 5 boroughs were pretty highly vaccination rates. That really wasn't a major issue. I think there was small, most of it was voluntary. A lot of it was forced due to work. A lot of people's workplaces required them to get vaccinated. So I think New Yorkers, as far as the city is concerned, had a pretty high vaccination rate. Either that or people had natural immunity, because at the beginning, at the peak of COVID, everybody in New York City was sick with COVID, whether they were hospitalized or not. So I think that helped alleviate, a lot of the symptoms that people were experiencing with Omicron, this latest variant. The symptoms were much more mild. So although people were getting sick, it was manageable from home. But I still do think that, masks, especially in super spreading environments, for instance, the emergency room where I work is becoming a super spreading environment, because you have people coming into the hospital to get tested. And then they're required to sit in the emergency room for 3 to 4 hours to wait for their results in a room full of majority of the people are positive for COVID, and it's highly contagious. It has what they call an R0, which is highly contagious, of 10. So one person can infect 10 people. You're sitting in an emergency room for 4 hours. If you didn't have COVID before you got to the ER, you're guaranteed to have it by the time you leave the ER. So masks is inevitable, especially in highly populated, super spreading environments where you have, rooms full of people.
I'm glad to see that. Go ahead, Camilla. I'm sorry.
There are many of my colleagues who are vaccinated and boosted, and they have been quite sick from Omicron. So don't be.
I'm in quarantine right now from having Omicron. Actually, I'm recovering from
These
Omicron.
people were, they were
The
not.
second time I caught COVID.
I've been maintaining COVID-free status as far as we know.
Congrats. That's a small club.
I know.
But I was going to say that I'm happy to see that a lot of the medical facilities here in the Houston area are very, very cautious. For example, whenever I go to for a doctor's appointment, I go to Kelsey Sable, and when you walk in, there's a temperature check, first of all, and secondly, you cannot go in there without a mask. So they're very cautious about people coming in without mask or with the temperature. So I think that's great that these kinds of precautions are being taken at a lot of medical facilities.
Yeah, I think it's important that they enforce it, but I mitigating this latest variant is going to be very difficult. I feel it's almost impossible. It's highly contagious, and it's almost the end game. I feel like for this pandemic, this is going to be endemic. We're never going to get rid of COVID. It's just going to be here to stay. It's going to continue to evolve and change. And
so that term they throw around, the new norm, is real.
Yeah, it's going to be the new norm, basically, unfortunately, having to wear masks and use those extra precautions to protect yourself, eat well, eat healthy, change your lifestyles, exercise. These are all things that we're just going to have to incorporate into our daily life.
Right.
I think that was one of the questions. What would you recommend for someone who may have contacted COVID during that healing process? What are some of the things they can do to get through this and kind of help bring the healing to pass?
Well, across the board, I mean, we know what we should be doing, right? I always use the saying that an ounce of prevention is a pound of cure. So, I mean, we know not to smoke. We know that we shouldn't be eating fried foods. We know that, healthy diet and changing your lifestyles are always going to improve your quality of life across the board. Making healthy lifestyle choices, eating the right kinds of foods, protecting yourself, cutting down on the amount of red meat that you eat. Heck, I've completely eliminated meat out of my diet, but that's just me. And these are all things that I feel had a huge contributing factor into how I fared when I caught the virus.
What about vitamins, like vitamin C and
zinc?
Supplements, taking turmeric, elderberry, vitamin C, eating lots of fruits that have vitamin C's in it, vegetables, sea moss. Incorporating that into your diet is also very good. Building your immune system, just working to have a strong immune system from the go.
Yes. So you guys, I hope those of you who are listening are taking notes, because there are some things that we can do to make us a little bit more a little bit less susceptible to this virus, not in the sense of catching it. If you're in a contagious place and you're open to catching it, if we build our immune systems up, we're more likely to get through it without a bunch of, at least hopefully, without going on a ventilator.
Right.
Yeah.
While we have
Body.
Dr. Gamilla Pierre here, I want to ask Dr. Pierre, in your profession, what would you recommend for a woman that is that's pregnant with who contracts COVID? Should she continue to have her child evaluated afterwards?
They don't really do that. Really, the issue is prenatal. It is recommended by the CDC and the American College of OBGYNs that pregnant women are vaccinated and boosted. It is a strong recommendation. It's been a recommendation since the vaccine first came out. People have slowly adopted it, but a lot of pregnant women are still skeptical, but it is a pretty strong recommendation. We see pregnant women who are unvaccinated. They get sick. They get very sick, ICU type sick. I would say right now on a given day, half of my laboring patients are COVID positive. There's, there's a lot of questions about what does that mean for the baby? It probably has a lot to do with at what stage they were pregnant with COVID, the severity of COVID. So I would leave that to the pediatricians. I don't think that they would just routinely check the baby unless the mother was actively positive with COVID around the time of delivery and very ill. Then they do routinely check the baby and check the baby's status. But really, that's been I don't know the numbers, but I would bet that as far as groups that are unvaccinated, I bet the pregnant women group fare higher than other peers that are vaccinated. I mean, that are not pregnant, just because they have this fear. But it's actually the opposite. So we've been really trying to cross that hurdle. And then we know that generally speaking, vaccines are safe. And the baby does tend to get some antibodies from the mom developing antibodies from vaccination. So we have very good evidence that the COVID vaccine is completely safe, and not only safe, is very, good idea to prevent a very bad illness. The other problem with COVID and pregnancy is if you happen to be COVID positive at the time you're in labor, it can change your whole labor experience. Because you can't necessarily have the same visitors that somebody who's not COVID positive have. You can't, necessarily go see your baby in the nursery. So there's some reasons to try to not get COVID, especially when you're pregnant, other than the fact that you don't want to get sick. And, you don't really want to be home with a newborn and you have COVID and you're trying to take care of them. So a lot of good data that are very much in favor of pregnant women getting a COVID vaccine and a booster.
So, Doctor, wouldn't some of this still be kind of open because of the fact that we haven't had COVID long enough to determine what would be the long-term effect? Because there are some questions about even the long-term effect on some of the people who have COVID. So
back to my original statement about science, that's true of everything. That's just true of everything. There's always going to be a time effect. And yes, in 10 years, are you going to figure out that's what happens when people have COVID and long haul? Yes, absolutely. Are they going to find out something in 5 years about COVID that we don't know today? Of course they are. That's how this works, because we're going to have more data. We're going to have more information. But that's true of all of science. It evolves. It doesn't stay the same. Sometimes you get more clarification. Sometimes you get more evidence that what you thought was true. Sometimes you find out that what you thought wasn't true. Yes, that's going to happen. But you don't have the luxury to jump into 5 years and know. So you can only go with the information that you have currently. And that information, now the good part about the information you have currently in a pandemic is that you get a lot of people really fast. So many conditions take a long time to study because you need a large group of people. Well, the nice thing about COVID is it gave you a whole bunch of COVID people really quickly. So you could study the virus and the vaccine quicker than you could on some other conditions, which are not as common. So you always have to take all that into effect. But absolutely, I acknowledge that in 5 or 10 years, we're going to know more about COVID than we do today. But that's true about everything. I mean, that's just a fact of growth, right? So, but you can't jump to you can't jump to that at this point. You have to recognize and be willing to give. That's going to be a given, but also we got a lot of good information just based on sheer numbers. And it's not just numbers in the United States. Remember that. Our numbers are big because they're worldwide numbers. This is not just our numbers. We got numbers from probably near 1 billion people. That's pretty crazy if you think worldwide. So don't think so small as just thinking United States. You got to think bigger than us, because COVID has hit the entire world. This is nothing we've ever seen. We've never been in a 2-year pandemic ever in our lifetime. So this is pretty impressive, the amount of data that you can get so quickly because of the sheer volume of people that are affected.
Yeah. So we know that COVID has had the most devastating effect on people with weakened immune system. Once again, Doc, what would you recommend that people do to boost their immune system?
I think Lorraine touched on it very well. So at the end of the day, most diseases are because we don't really live the right lifestyle. That's at the crux of probably 90% of the diseases that we have. And it's because we don't feed our bodies properly with mind, body, spirit, nutrition, all of that. So if you go back to that as your basis and build your immune system on sleeping, okay? Because you don't get enough sleep, you have a decreased immune or a depressed immune system. You don't eat well, you have a depressed immune system. So it's the common sense that we really all know. It's nice to think about vitamin C and echinacea and all that, and those things are great, but really most people don't do the basics. So if you just kind of take care of the basics, you exercise, because that does build your immune system. You eat properly, and we know what that generally means. Some people need some tweaking on that. You sleep. Sleep is very important for repairing our bodies. Then you can add, but when people tell me I'm taking vitamin C, but they're obese, well, that's not going to help you because you took vitamin C, but yet, you have a diet of candy and cupcakes. I might be one of those people, but I'm just saying, people need to be realistic. Vitamin C is not going to cure you when you eat poorly, or when you don't sleep properly, or when you don't treat your body well throughout. You can't just all of a sudden say, well, if I take a bunch of zinc, then I'm not going to get COVID. That's not how that works. So overall, I think those extra things are good, but those are adjunct after you've done the basic stuff, which we know what they are, but people want something easy and fast but it's hard work to live right. Right? It's true. I say that as one of those people. I don't sleep well at all. It's terrible. And I know that depresses my immune system. That's the nature of my job. What am I going to tell you? I'm working on that.
Behavioral changes are the hardest changes to make.
Exactly.
But you're right. You cannot replace those things that you should be doing with vitamins alone. Vitamins are supposed to be a supplement.
Right.
They're supplements. They're not the cure-all. So You're right. Exercise, proper eating, and sleep. Lots of sleep. doing those things in addition to those supplements would probably help it along some.
Right. And getting your mind together,
Yeah,
obviously.
spirit, soul, and body. Amen.
Absolutely. So
Spirit, soul, and body, absolutely.
it's actually very easy. We make it complicated, but it's really not.
I think your dad said it well, because your dad, Camilla, believed strongly in meditation.
Yeah.
He believes strongly in meditation and proper eating. Of course, he was vegan, of course, but
And smoothies, which I don't believe in smoothies, but he had a point there, because honestly, that prolonged his life. I mean,
absolutely.
But his way of being and living did prolong his life. So
because initially doctors had given him how long? 6 months?
I don't think it was that, but I think he did defy the odds that most people with COPD have multiple hospital admissions, and we didn't have that. We had
because of his lifestyle, right?
Right, and I always give him a lot of credit for that, because he did the best he could, and he really prolonged his life, and he not only prolonged his life, he actually prolonged his quality of life.
Yes.
And so that's kind of what you're talking about, because even though it was hard on him at the end, he still had a decent quality. It wasn't the ideal, but it was a far better quality than many patients with COPD have at his stage.
Right.
And I think that's one thing that kind of surprised everybody about how sick he really was.
Right.
It's because he looked well, and most patients at his stage are not even as functional as he was able to be. And I do always give applause to the fact that he changed, and he didn't have a lot to change because he was always fairly healthy, but by improving his lifestyle significantly, that just showed you over 20 years, how that affects you, even when you have a diagnosis like COPD.
Right.
What impact has COVID had on the medical profession?
Ooh.
Ooh.
I can say, for one thing, it has changed nursing tremendously. I became a travel nurse, but I'm seeing across the nation, the hospitals are all experiencing the same type of shortages, staffing shortages. It was on the brink of being exhausted before COVID, because at least in New York, but now even more so. We had staffing issues before COVID. Now it's even worse. Even worse. There's just not enough staff, and people are coming into the hospital with flu-like symptoms that can easily be managed at home, and they're exhausting the hospitals because they want to come to the hospitals to be tested. And on top of the true emergencies that we're experiencing, it's crippling the hospitals.
It's changed it's changed people in a very sad and negative way. The healthcare workers are quite jaded now. So you see people like, yeah, whatever, you got COVID, and part of that is the fatigue of trying to care for a large quantity of people. That's one thing. But because, unfortunately, the nature of the polarization and the politicization of the virus, well, when people come to the hospital and yell at me and say, don't ask me if I got vaccinated, I don't ask people if they got vaccinated. I actually don't ask you. They usually volunteer, but I don't ask. Whatever, you're here now. It's kind of a moot point, right? The problem is when they want to fight. I have patients who want to fight with me about it. I'm not here to fight with you about whether you think this is a hoax or not. We're at the hospital. We're here to do medical care. But that has made people fatigued. It's made people I think people are doing a decent job, but people will become less compassionate when they are having to fight at work. You don't go to work to want to fight with people. you go to work because, you know, you're here to take care of people. So then what happens is, unfortunately, you get what happened with the CDC recently. People become very jaded. Well, 1 minute the CDC says we got to have a quarantine for 10 days. And literally the next day they say, well, no, it's 5. Well, all those people who got tested on Tuesday, they're like, well, do I come back to work? I'm supposed to come back Tuesday. So now do I come back? So then you get a lot of people saying, well, they got 10 days off and now I only get 5. It has made us not, it just changed the character of people in a way that's just not good. And that's what I find very sad. And I think in the beginning it was like, okay, we're kind of, we're all in this together. And that was real nice for a few months. And then people were like, I can't stay home like this all the time. Rightfully so. It was too crippling to a society to just go and stay home. And then it became, it's the healthcare workers are giving everybody COVID. And then it became this like battleground. And it just turned the character of people. So it made like this strange, it's just made people very strange. I don't have a better word, but it's odd. And then there's all this, you know, I hate talking about COVID. I don't have a choice. But I got to the point where I don't want every day all I talk about is COVID. Because why? Because people still have diabetes. They still have high blood pressure. They still have this. And those conditions are equally as important as COVID. And when patients just stop the conversation because they just want to fight about what do I think about the vaccine? Yes, you should get vaccinated. Next. I mean, it's not that complicated to me. It's really straightforward. So what I hate about COVID is how it's made us against each other. We always were kind of, you know, fighting, but that makes me it makes me sad. It makes me sad because I want people to come to the hospital because they're sick, or in my case, they're going to have a baby or whatever. And then we just do our thing. We take care of you. We put in an IV. We do whatever we need to do. I don't want to be thinking this one didn't get vaccinated. Now they're not telling me they're COVID positive because we have that. Do I have my right PPE when I go in this room? Are they going to yell at me because, you know, they want off-label treatment for COVID? We get that. People demanding off-label treatment that is not proven. Well, why aren't you giving that off-label treatment? You know, these other people say that works. When no other time in history, with the exception, are people demanding that healthcare workers and doctors give off-label treatments for things that we know don't work. I mean, so this is exhausting. And it just makes people tired on top of just doing the work because half your colleagues are actually home because they have COVID and they're in quarantine. So you're like, I can't fight with you and take care of my partner's patient because my partner's home with COVID. I don't have that much bandwidth. So I just hate COVID. I just hate COVID. Every day we say it at work. We hate COVID. COVID is bad. Obviously, we hate that it kills people, but we hate what it's done to it's just doing for my day-to-day work is all day. And Lorraine, I went to the ER the other day. I was shocked in my ER. It was, and I work in a busy hospital. I went to the emergency department. There were no beds. Patients were lined up in the hall like a MASH unit, a literal MASH unit. And I work in a suburban hospital. It's very pretty. It's new. It's nice. I've never seen that. I felt like I was on my mission field in Africa. They were lined up like that. I said, what is going on? The ER nurses just looked at me. They were like, Doc, this is what we deal with every day. And like Lorraine said, some of that is patients who come and I heard I might have COVID. I better go to the hospital. Well, no, it's okay. Stay home, take care of yourself. And now the patient who's, having a real problem, now they have to wait and maybe also get infected with COVID and then be mad at the hospital because it's the hospital's fault you got COVID because there's COVID there, but yet people aren't getting the message. And then it's just made everybody so on edge that you get extremes of all sorts of things. So it's exhausting. It just made me tired.
It's like moral injury, like this is not what I signed up for. And it's almost like you're desensitized to a point.
Yes.
It is really sad.
Wow. Yeah.
From a medical professional's perspective.
Yeah.
It's a hot mess.
Yeah.
That's my scientific word. It's a hot mess.
I can just imagine how that is. I mean, it's frustrating to me just trying to go to the store with a mask on. And these people think like looking at me like I'm crazy because I'm wearing a mask,
Right.
I know. I feel bad about you people living in Houston. See, in Chicago, we are under a mask mandate and always have been. So when I go home and I'm like, these people don't wear masks here. This is a hot mess. So it's even a more difficult environment because you have a whole state where they're just pretending COVID does not exist.
Yeah.
So at least in Chicago, we don't have that because, we can't go to restaurants. I mean, the mask mandate is real in Chicago. I mean, there are still people with COVID.
But oftentimes it depends on the political environment that you're in.
Correct.
Yeah.
Because I was in Alabama visiting, and I went to lots of places, and the only people I saw wearing masks were Black people.
Well, now
we're Black people.
I would like to say that that's true in Chicago. There are. It's interesting, right? The groups are very interesting. You see, I'm going to generalize here, so I might get kicked off the air. I'm going to generalize. My generalization is I see people who, and for lack of a better term, they may have supported the last administration. I'll just say it that way. And they may not believe in wearing masks. But I see just as many people who look like us, who also did not support the last administration, don't believe in wearing masks. And when you look at people who are unvaccinated, it's those two extreme groups.
Yeah.
And there's a very large group of people of color who are still stuck in, this is the Tuskegee experiment. They don't even know what that is, by the way.
Right.
Because they heard it on TV. And wear a mask. I just came from seeing a patient. She's we are a mask mandate state. A hospital, we all wear masks. She's having her entire conversation with me without a mask, telling me about her recent COVID status. Now I'm sitting there with my N95 like this. Okay. Let me get back, And she's just talking. She's not vaccinated. She's not wearing a mask. And she has COVID. She's the same color as all of us on this panel. And I see that all the time. So I see the two kind of polarized groups. And then you see pretty much the middle ground people who are on both sides of the political aisle and, wearing their mask and getting vaccinated. But there are these two, I don't want to call them fringe groups, but polarized groups.
Yeah.
And some of them look like us and some of them don't. But you'd be surprised how many people who look like us are right there, or they're doing this. This is my favorite. You might as well not wear a mask.
Right.
So let me say to all the people out there, this is not wearing a mask. If I see your nostrils, it doesn't count.
Right.
It annoys me. That I think as a healthcare professional, this annoys me more than anything in the whole world.
Yeah.
Cover your nose. There's stuff in it.
My wife and I went to a restaurant, and that's when we had the mask mandate here, and especially in businesses, public facilities. And we actually had a waitress who came to our table, just like you just described, with this thing just around her mouth, nose just
exposed.
Yeah.
wearing a mask. This
Yeah.
is not wearing a mask.
So one of the things that has come forth out of this particular variant is that there's been a large, quite a bit a heavier increase in the hospitalization of children.
Yep.
Well, if I can, because partially a pediatric ER nurse, what I've been seeing a lot of patients coming in with, a broken leg or broken arm or finger or, cut, a laceration. Oh, and by the way, your child is positive for COVID. So they have to be admitted now. Of course, it appears that those numbers are increasing, but the child is actually not coming to the hospital because they have COVID.
Right.
They're asymptomatic. This is what in my experience, what I've seen. And they, just, oh, by the way, you're also positive for COVID.
Mm.
Yeah. I just read an article this afternoon that I think it was in Riverside, California yesterday, that a child under the age of 1 year old died from COVID.
Well, this same young lady that I told you I just saw before I came to the call, who's not wearing a mask, has COVID, she told me, she says, oh, I'm here and my kid just got out of the hospital. The kid is 5 years old. Kid had COVID. The whole family had COVID. Kid just had open heart surgery because of the damage that COVID did to this little 5-year-old.
Hmm.
So, now that's a real thing. I mean, granted, it's not that common, but the fact that I hear of it even a few times for something like a small child, you don't hear that in random diseases. So it's like, okay. And I'm pretty sure that kid, 5 is the new age. I'm sure they didn't vaccinate their kid, but she's not vaccinated.
That most likely that child is not going to be. Well, I mean, that child now has natural immunity.
Well, natural immunity and a broken heart, but
Yeah.
needs more open heart surgery. Telling you, so it's pretty. That's pretty, impressive actually. We're not used to seeing a disease process that would. I mean, that they exist, but not to this many people at one time. That's where it's just a strange phenomenon. There's
been a few severe cases, but I mean, in the emergency rooms in New York, actually, the numbers for COVID pediatrics have gone. They've actually downsized the departments, and the adult ER has taken over the pediatric areas because the numbers have gone down so much. But I mean, it's a threat, but it's just not as much of a threat.
Yeah.
Well, I just got to say, man, y'all have really given us some good information tonight, and we really appreciate y'all being here with us. And those of you who are watching, let me see if we have some questions here. We have a question here that says, do you know of any babies that are born with COVID?
I have not heard as much, but none that let me rephrase that. None that I've taken care of personally, but I have heard of one actually in the community, but none that I've personally taken care of.
Yeah. That was actually born with COVID?
Yeah, the mother had COVID, and so when the baby was born, it actually was also had COVID. Yes.
Wow.
Yeah.
So guys, we want to thank y'all for tuning in tonight, and we want to encourage you to share this broadcast.
Amen.
And these two healthcare professionals that's with us here tonight, hopefully we're going to be able to get them back on, because this is this is real.
Yes.
This is real. And one of the things if we got one or two people tonight who saying that, hey, I'm going to take this serious. I'm going to I'm going to start wearing my mask. I'm going to go and get back vaccinated. Then this has been worth it. This has been worth it. And
Absolutely.
hopefully we can get them back, because this is important information that needs to get out to our people, because there's a lot of questions. And this is something we're dealing with every day now in the present on a daily basis.
Amen. And those of you that have problems with science and its exactness or whatever, I think Dr. Pierre said it eloquently when she said that science is evolving. It's an evolving,
Yes.
but what we have certain kinds of masks one day, and the next day it's a different kind of mask, because science has learned something different, something new. So science is evolving. So don't give up. Wear your mask, get vaccinated, get your booster shot, social distance as much as you possibly can.
Yes. And Minister Parker, just so happened, for the benefit of those that might not know, you know these two ladies personally, right?
I've never seen them before in my life. No, they're both my nieces. Dr. Pierre is the daughter of my brother Aubrey, who went home to be with the Lord about 4 years ago, almost to the day. And Nurse Lorraine is the daughter of my oldest brother, my oldest living sibling, Waverly. Yes, these are my nieces, and we're so proud of them.
Yeah.
And I'm glad that they took the time to come on to inform the community and inform us about things that we should be doing.
You're welcome.
We have another question here. Says, is there any statistics on which vaccine given to people that are still contracting COVID? Wait a minute. Is there any statistics on which vaccines given to people that are still contracting COVID?
Well, so I don't know what that question means exactly, but I'll try to answer it in two ways. Number one, we knew that the COVID vaccine would not necessarily prevent you from getting COVID, but prevent the serious symptoms and side effects of COVID. It's similar to the flu shot. People often still get the flu, but it's not as bad. So we kind of knew that with the COVID vaccine. So yes, there are people, and not small numbers, there are a large amount of numbers of people who will still get COVID, even though they have had the COVID vaccine and had a booster. The majority of those people will have very mild symptoms. Now, those symptoms might kind of knock them off their feet for a day. It doesn't, some people get a runny nose. Some people get nothing. Some people say, wow, that COVID was kind of hard. 24 hours, I was in the bed. Okay. Well, if you know anybody who's truly had the flu, the influenza flu, that is 7 days, you're down. 7 days. So the fact that you might have COVID and you get kind of 24 hours of kind of being knocked down, it's not pleasant, but that's very different from I'm in the hospital and now I need oxygen to go up a flight of stairs. So I think that they always have to go back to the vaccine. And nobody ever said this, but people, they wanted to kind of spread this propaganda. Well, you shouldn't, I got the vaccine, so I don't need to wear a mask and I don't need to get I'm not going to get COVID. And that was never said.
Right.
It would the chance of getting COVID. And then, but if you did get COVID, it would reduce the serious nature of your symptoms. So that question about, how many people get it, a decent number of people. I don't know the numbers, Lorraine, maybe you do. So, but I don't think that's a secret. That wasn't a secret. Like, oh, you still might get COVID. That's where the mask comes into play.
Right.
That's why you still social distance. That's why, because you're still not trying to get COVID. But you say, well, I got the booster so that if I get COVID, then my COVID symptoms are much more likely to be milder. So that's
Right.
And
Yeah.
Lorraine, I see you amen in something there.
No, I mean, I am one of those people that can vouch that the symptoms were much less. They were very mild for me for the second time around that I fought COVID. But yeah, in my education for my patients, I've never ever once, I've always educated, that this does not mean there's not the cure all. It's not 100% foolproof. Nobody ever said that you can't catch COVID if you don't get vaccinated. But based off of my first experience of getting COVID, I never wanted to get that sick again. I didn't have to be hospitalized, but I felt awful. And I didn't want to experience that again. So therefore I got the vaccine, and I'm thankful that I did, because the second time around, my symptoms were very mild. It was one day, I felt really bad. And then I had a very quick recovery and have a mild cough, but otherwise I was literally on my back for almost 2 weeks the first time I had COVID.
Yeah, but I have been blessed. I lived in a household with a wife that had COVID, and thank God, I because of my lifestyle and because I avoided being around her during the time that she had it, and having some underlying issues, health issues. I mean, I've been blessed to have not had it.
I tell you, I miss my father immensely. I'm glad he was not here during this. I wouldn't have been able to take the stress. He wouldn't have let anybody in the house.
I know.
I know.
I would have to just move in.
He would not have let anybody in the house.
Nobody. You have to go through the window, not just stick something through the window.
He would have said, "Don't touch my window." But
take your shoes off when you come in.
He wouldn't have let anybody in. I guarantee you. He would have said, "Yeah."
I agree with you.
And I think that's another thing that people have to keep in mind. None of these vaccines have never said that they was 100%. So even if the vaccine that you take, they say, well, this 90%
efficacy.
Then that leaves 10%. 1 million people, 10% is 100,000.
Yeah.
So it's not the fact that that is going to stop you from getting it, but if you get vaccinated, according to all the science, I just heard a doctor here in Houston yesterday saying that 85% of the people that's being hospitalized here in Houston is people that's unvaccinated. 85% of it.
Yeah.
So only thing that we can do is give you the information so you can do with it what you want to, what you feel you have to do with it.
Amen. Amen.
But we certainly thank, and we also have someone here say thank you both for your expertise. We appreciate you giving us your information and time. Blessing to you both, and be safe.
Thank you.
And I think that kind of rings from all our heart. We really appreciate you all taking the time to come to share with us on this platform and getting this word out to the community. We are going to not only on all our platforms, we're on like 6 different social media platforms live right now. But one of the things I'm going to do with this one is we're going to actually promote it where we, you pay and it goes out all across the country. So we want to get this out.
Amen.
So once again, thank y'all so much for your time. Thank you for your professionalism that you brought forth here tonight.
Thank you for inviting.
Thank you.
Glad to see you, cousin.
Likewise.
It's been a minute, huh?
Okay, guys. Thank you, everyone that's tuning in tonight. We want to thank you for tuning in, and we certainly hope that you've been blessed tonight. And we want to encourage you, please share this broadcast because
Amen.
there's someone you know need this information.
Right.
So we're going to go ahead and get out of here. So until next time, this is Pastor Holley saying, may God bless you.
And this is Minister Terry Parker saying, and may you bless someone else.
Oh,
Shalom. Shalom.
Oh, we forgot something. Tomorrow morning, 9:45, we're on live with the Love Center International Sabbath Fellowship. So go to lovecenterintl.org. That's lovecenterintl.org, and click in. When you go to that website, you just click that join, and it'll bring you right into the fellowship.
Amen.
So we'll see you tomorrow morning. Hallelujah. Shalom.
Shalom.
Thank you, ladies. God bless.
Bye-bye.